You're actually working in conjunction with Imperial.
We are looking to improve the diagnosis of congenital abnormalities, and at the moment, for some abnormalities like cardiac abnormalities, where if you know the diagnosis, you can actually change the outcomes for the patients by giving them much better treatments. Only about half the patients are picked up, half the babies are picked up. So at King's we were able to collect data on many thousands of mums, and being able to then combine that with a fantastic computer science expertise at Imperial, we came up with a novel, innovative solution to help move the field forward, and also in the years to come actually reduce substantially the number of undiagnosed babies, so we can make a real difference to lots of children.
I particularly work identifying brain injury, so either in babies that are born prematurely or in babies who are born at the right time but have a very difficult delivery. We can say an enormous amount about what's happened to a brain and what that might mean for the child, and so that we have a lot more information that we can tell parents about early on. In days gone past, they were often just said, you'll have to wait and see. And nowadays we can pinpoint problems and put different therapies in place to try and help with that child. Every woman in this country probably has an ultrasound at some time in her pregnancy, but MRI is complementary and way superior in certain aspects, particularly from the research point of view.
Can you paint me a picture of the impact that your research could have on social health and well-being?
Primarily what I'm interested in doing is understanding more about the developing brain and what affects it, good and bad. Improving imaging technology would allow us, I think, to understand about what aspects of particularly modern day living affect the unborn brain. It could be anything from mum having an infection when she's pregnant, or perhaps environmental factors that we feel may be particularly important that are affecting all of us in different ways at the moment.
Normally scans are done by people who are trained around the UK, but they are quite hard to work out what's going on in these scans unless you're a real expert. So actually there's huge variation in the pickup rates. In some areas of the UK, only 10% of the abnormalities are picked up, and others it's better. If you got a super expert, they'll pick up almost all the abnormalities. But there's only 19 part-time people in the UK who are those sort of specialists.
Especially, you know, with the constraints that we're currently experiencing with regards to the shortage of doctors, you know,
That's
expertise available.
To pick up those, you need hundreds, if not thousands, of people doing those scans to be able to get them all done. And here we're developing the technologies to help those people to really improve the success rate of those scans. So the power that computational methods are going to bring into health are enormous in the next few years, by being able to learn from what we have done before, to be able to do things to aid the clinicians with a much higher diagnostic yield. What we need to move these type of things into the NHS and wider afield is collaborations between the different universities in London.